I'm an obstetrician gynecologist. I'm Dr. Rita McGuire. I'm the Chief Medical Officer and one of the co-founders of Wakana. And every Wednesday night is my night to cover the hospital as it relates to any patients who are in labor, any patients who are going to deliver, and any patients that comes through the ER and has some sort of GYN surgical emergency. So that's me. We call them the doc in the box. So I'm the doc in the box every Wednesday evening. And last Wednesday, I had an emergency. So thank you for being so patient. But last week, I was going to talk about this topic of atherosclerosis, heart disease, right? It is February. And what does that mean? It is Heart Health Awareness Month. Yeah. It's the month where we really want people to focus in and think about, are they doing things in their life that's going to contribute to a healthy heart? Okay, so tonight, if you don't mind, I do want to dedicate this webinar to my mother, Jean King McGuire. My mother, rest her soul, is in heaven. She passed away 22 years ago on February 11th. My mother was overweight. My mother had hypertension, high blood pressure. My mom had high cholesterol. And yeah, she developed a lot of plaque in her arteries and had to undergo a triple bypass. Unfortunately, my mother did not survive her 6-week post-op course. She developed atrial fibrillation and passed away. So I dedicate this webinar to my mom, Jean King McGuire, my Shiro, my mother, and hopefully this information will bring awareness to you, to your family members, maybe to your mom, your grandma, your coworkers, your spouse, about how important it is that we take good care of our heart. So a little bit about myself. I am a proud mom of 3 adult children. Yay! I only have one left on the payroll, that little girl. But my oldest is 31. That's Jacob. He's in the middle. My middle child is Joshua. He's 26. Right. Yeah, that's right. And then my daughter is 24. Both of these young men are in business. They're in the other part of the world, right? And only one decided to go into medicine. So my daughter has been accepted to 2 medical schools. She's still waiting on a 3rd. But I keep telling her, you only need to go to 1. But we're so proud of all 3 of our children. But yeah, that's my family. I'm still a practicing physician. Obviously, I'm here on call. I am still doing hysterectomy, C-sections, delivering babies. Also do a little bit of cosmetic surgery, not too much, liposuctions, tummy tucks. I've been doing this for 30 years and I can't believe it. I'll be 60 years old. I'll be 60 in 8 months. Can't believe that either. But I love what I do. And that is something that many of you may be curious. You may be thinking, well, what in the heck is an OB-GYN doing in a cannabis industry, right? Well, that is a story that starts with our visionary, Melissa Boston. She is our CEO. And 4.5 years ago, Melissa reached out to me. I didn't know her personally, but we followed each other on social media. And she reached out to me and she said, what do you know about CBD? I've just been asked to be CEO of a CBD company, and I would love for you to be a part of it. Well, I didn't know anything about CBD. I didn't even know what she was talking about. I was too embarrassed to tell her I didn't know what she was talking about. So I tried to research it. I was just like, I think she means CBC. I think she's talking about a complete blood count. I think she's trying to sell me a lab. Dear Melissa, no, I'm not interested, right? She's like, no, CBD, cannabis. I'm like, oh. And so I was able to do a lot of research on CBD, and I got super excited. And I got really excited because, see, CBD, as you're going to learn today, is a natural herb from the earth that God has given us that has really helped hundreds and thousands of people all over the world to improve their health. So the only part of CBD and cannabis that I knew about were my three children, right? Them consuming the other part of the plant, marijuana. But I was excited because my patients are looking for options to their health, family members, co-workers, and even myself is looking for options for their health. See, in 2009, I had a very bad ski injury. I tore my ACL, my MCL, and my meniscus. I've been skiing since I was 4, just a little tot. And I decided at the age of 45, because that's how old I was in 2009, I decided that I was going to start racing. So I started racing in Banff, Canada. I won this huge medal, right? I was like a beast. Then I decided to race in Colorado. Well, if you're out there and you're a skier and you know anything about the terrain in Canada is very icy, and the terrain in Colorado is very fluffy with snow. So as a racer, I didn't realize that I had to maneuver my skis, and unfortunately, one of my skis got stuck. And then I tore my knee up. So for me, CBD has been amazing to reduce inflammation and pain in my knee. Sorry, but I got off on a tangent because we were talking about our visionary CEO. She is the one that introduced me to this industry, and so forever grateful to her, because then I was able to meet these other incredible women. Our president is Patricia Van Pelt. She's a state senator. She's going to be serving very soon her 4th term in the state Senate. And then our CSO, our chief sales officer, Phyllis Nash, our midwife, who is an incredible businesswoman as well, that is really helping and very effective in helping us to birth all of the business opportunities and sales that is within us. So this is what we call our 4 co-founders. So I wanted to introduce them to you. And in the last 2.5, we will be 3 years old on April 20th, 4/20/2022. If you're on the line and you're a guest, you don't want to miss our wealth conference, which will be in April. But we've done over $6 million in sales, despite a global pandemic, despite being an online direct sales company. We have really exceeded all of our goals. So we are excited to have you on the line tonight to really learn about our products and to learn how they can really assist you. We have a medical advisory board, a board made up of healthcare professionals, not only MDs, but naturopaths, nurses, chiropractors, pharmacists, clinical psychologists, therapists. We're looking for some veterinarians. So if you know a veterinarian, we are looking for veterinarian because we want to offer CBD products for our dogs and our cats. But these are just some of our medical advisory board. Each and every month, we're updating this flyer so that you can see that these professionals really are advocates for using CBD in their practice, using CBD in their community, utilizing it personally, and really educating our distributors. So I was asked to testify in front of the Judiciary Committee for the legalization and taxation of adult use medical or recreational marijuana here in the state of Illinois. So we are the 11th state to adopt the adult use. And yes, the governor, J.B. Pritzker, he summoned me and had a driver for me. And I was testifying here, explaining to the Judiciary Committee the medicinal benefits of this plant and how important it is that it is available to everyone. So now I want you to take a couple of seconds, if you don't mind, pull out your paper, pull out your pen, or maybe you can put this in your phone. And I want to ask you, if you know your blood type, do you know what your blood pressure range is? Or maybe you don't know your blood pressure. Maybe you may know a normal blood pressure. Do you know your cholesterol level? Do you know your hemoglobin A1C? Do you know your HIV status? Do you know when your last mammogram? And when was your last pap smear? So if you're a male, of course, you can't answer the last two questions. You get a pass, but those other questions, if you're on the line, if you're a male, just jot them down. Let me know if you know. I'll ask you at the end if you know these numbers, because these numbers are really important to know. We know our social security number. We know our ATM password. We know our children's birthday. We know phone numbers, but many of us don't know these numbers and don't know these facts about ourselves. So take you back a little bit. 7.5 years ago, I was over 211 pounds. At the time, I had lost my mom, my dad, and both brothers. Not at all one time, but honestly, guys, every 3 years, I lost either a parent or a sibling. Every 3 years. And when I lost my brother in 2014, I honestly thought that I was next. I was working 96 hours a week. I was a single mom, busy practice. Back then, I was delivering 30 babies a month. I was a crazy woman, right? I was eating unhealthy. I was not sleeping because I was working 96 hours a week. I had a horrible diet. I tell people I was the most unhealthiest doctor in the state of Illinois, hands down. I was drinking a lot of alcohol, not an alcoholic, but I would drink alcohol every time I went out to dinner, every time I went out to lunch, social, right? My drink of choice was an apple martini because it tasted like candy and it didn't taste like alcohol. So it's full of sugar. So I made a commitment to myself 7.5 years ago because I thought I was going to die next. I thought I was going to have a premature death like my mom, my dad, and both brothers had. And I wanted to live for my children. So I made a decision and a commitment. I lost 67 pounds in 6 months. I changed my whole life. My whole life changed. I changed my diet. I started exercising. I started sleeping, and I started drinking water, right? I did it the old-fashioned way. There was no surgery. There was no liposuction. There was no diet pills. There was none of that. The old-fashioned way. In fact, at that time, I had become a vegan. I removed animal protein. I removed dairy. I was a vegan. And I'm telling you, I was 52 at the time. I felt like I was 21. The best shape of my life. I ran 3 marathons. I ran 2 triathlons. I did a Ragnar race. That's when you run 200 miles. 200 miles I ran with a relay with a group of women. Crazy, crazy things. I did a Tough Mudder. I was crazy at 52, but just know that my life changed for the better. So when we talk about atherosclerosis, this is something my mom had. She passed away from complications due to atherosclerosis. Sometimes it's hard to say, right, when you've had a long day. But it occurs when cholesterol, calcium, and fat hardens your arteries. That's really what you need to know. And it can occur in an artery in anywhere in your body, like your legs, your heart, and your kidneys. This condition reduces blood flow to vital organs when you start to have this buildup. So this is what was the demise of my mom. The arteries started to fill up so much with plaque that she needed a triple bypass. She needed the surgeons to make the blood flow in those arteries improved, but she did not survive that surgery. So we know that the top cause of death for men and women is heart disease. In fact, in 2015, it's led to 15 million fatalities. 25% of all fatalities in the US is due to cardiovascular disease. Hundreds of thousands of people die every year to something that's preventable. So when we talk about risk factors, having any two of these factors, high blood pressure, high triglycerides, or bad cholesterol, having very low good cholesterol, your HDLs, having impaired glucose metabolism, having issues with diabetes, and having a large waist. Having a large waist is a huge liability. You see those guys with those beer bellies, or even women who you think are pregnant but are not pregnant, and please don't say when your baby is due, because they may not be pregnant. They just have a large waist. Having any of those two may increase your risk of heart attack or stroke. Then you add on African American and being obese, that even increases it even more. So my mom had several risk factors, right? She was an African American, she was obese, she had high blood pressure, she had high cholesterol, and she had a very large waist. So we see that among Black women and Latinas that are overweight, it increases their risk of heart disease by 80%. If they're diabetic, it increases, as a Black woman, increases their heart disease by 11%. If they're Latina, it increases their risk by 15% if they're diabetic. And then you add in that high blood pressure. For Black women, it increases their risk 53%, Latinas 30%. You add on that they're not exercising. They're couch potatoes. They're not moving, right? The only movement I had 7.5 years ago was running to deliver a baby. Outside of that, I did not work out. Some of the symptoms of atherosclerosis is dizziness, fatigue, shortness of breath, chest discomfort. These are really very important symptoms that you should pay attention to if these are occurring. We see that, again, when we start to have plaque build up in the arteries and decreased blood flow, it will cause a lot of these symptoms. Some other physical effects may be sleep apnea. We know those people who snore at night, right? That needs to be checked out. Irregular heartbeat, swollen feet. That's like the #1 sign, right, Dr. Kim? When we see those swollen feet, we know that blood supply is not at its optimal so that exchange can happen. So we're having a lot of pooling of blood in the feet. So physical activity is something that really has strong evidence that if you start moving, this can reduce your risk of heart disease. In fact, they did this landmark study, the Framingham study, and it really showed that those who were able to work out decreased their risk of heart disease. And they are now looking at the grandchildren and the great-grandchildren of the original men and women that were studied in this study in 1948. Being Black and menopausal, when you're menopausal, your hormones, estrogen and progesterone, decline. This decline further increases your risk of developing heart disease. And a lot of times when we are menopausal, we may mistake some true heart conditions and symptoms for menopause. Oh, that's just my hot flashes. That's just my night sweats. That's just my heart racing fast because I'm menopausal. No, this could be a sign that you are and have developed serious conditions with your heart that needs to be evaluated. Sleep is another factor that they've done a lot of research. They've studied people that fall asleep between 10 and 11 o'clock. Did you realize that the time you go to sleep can impact your heart? So get in bed early. You know, those who are in bed later, they were found in this study had an increased risk of heart disease as well. So get in bed earlier, get your 7 to 9 hours of sleep, and make sure it's restorative, restful sleep. We'll talk about some products at the end that really help to give you that REM sleep, that restorative sleep. So some other causes of atherosclerosis, we talked about high cholesterol, diet, aging, smoking. Hopefully none of you are out there that smoke, but if you do, we've got a CBD product that helps with that, diabetes and obesity. But it's not really about the cholesterol. And I want to just give you this information. It's not just about the cholesterol. We are consuming too much dietary protein, too much animal protein. This also leads not only to heart disease, but chronic degenerative inflammatory diseases, autoimmune conditions, right? Increases the risk of stroke and arthritis and diabetes and possibly osteoporosis. So reducing that animal protein, reducing and removing your dairy, all of these things improve your heart. Stress is another condition that can cause an increased risk of heart attack, stroke, metabolic disease, heart failure. There's some studies that have done where they looked at high cortisol levels. That's that stress hormone, right? From long-term stress. They've shown that this can increase cholesterol. It can increase triglycerides, blood sugar, and blood pressure, right? So these are common risk factors for heart disease. So stress can also cause changes that can promote plaque buildup. So stress can also cause an increase in our blood acid level, which can lead to, again, shear stress and can cause atherosclerosis. We look at the normal pH of the body should be alkaline. When we look at people who have high acidic levels in their blood, yeah, they're at risk for heart disease, high blood pressure, stroke, cancer, autoimmune disease. All of these chronic illnesses can occur when the acid is too high in our body. So we want to make our body alkaline as much as possible. How do you do that? Well, a lot of that is done through diet. Diet. That's how you balance not only the blood acid in the body, but you balance also minerals and vitamins in your body. Know your blood type. Hopefully, many of you answered that question. I'm type A. Type A is a vegetarian blood type. I'm a vegan right now, but this is imperative that you learn about foods that you should avoid because our blood type is our internal chemistry. And if we are eating foods that are putting our internal chemistry in jeopardy, improving or increasing inflammation in our body, all of these are external stressors. So I highly recommend that if you don't have this book, many of our distributors have this book, but understanding if you don't know your blood type, get your blood type done. We can help you get that done too, but eating right for your blood type. So studies have shown, and I've been saying this all week and all month, that a plant-based diet reduces your heart disease by 40%. By 40%. It's lowering your cholesterol levels. It's also reducing the risk of other comorbidities like diabetes, hypertension, stroke, and arthritis. A plant-based diet, and even there's studies with depression and anxiety, how a plant-based diet can help improve those as well. But 40% can be reduced by embracing a plant-based diet. Some other benefits of plant-based diet is that it reduces high blood pressure, hypertension. We talked about that by 34%. It also is associated with lowering the total cholesterol, lowering that bad cholesterol, that LDL cholesterol, and the benefits of plant-based diets helps to reduce your weight, and reducing your weight will reduce all of those comorbidities as well. So some of the current treatments, of course, in improving heart disease is, of course, lifestyle modification, exercise, nutrition, stress reduction, removing toxic people out of your life, toxic environments. It could be a job. Today, I just fired one of my contracts. Yeah, I did. I sent in a resignation letter because it was a toxic environment. It was a toxic environment. So stress reduction, medications, many of you may be on medications, amlodipine, nifedipine, valsartan. I mean, there's so many anti-hypertension medications, Dr. Kim, I can't keep up with them, but medications, even surgery, like my mom went through, right? A triple bypass. But there's also CBD. So CBD is not a substitute, but it is a tool that you can use in your toolbox to improve your heart. CBD is used by lots of cardiologists, lots of internists, lots of rheumatologists and neurologists and GI physicians and oncologists. You know, CBD has an immunomodulating effect. And what that means is that it alters the immune system's response to help reduce atherosclerosis, to reduce blood sugar levels, to reduce inflammation. So we're going to learn more about CBD. This is another study that found that CBD is a vasal relaxant. It helps improve blood flow to vital organs as well. So when we look at the plant, cannabis, now there's some schools that say that cannabis really doesn't have two species. It just has marijuana and hemp as part of the cannabis sativa L, but we're going to make it simple. Two species. One is marijuana. That's a species that gives you the high, and the other is hemp. Hemp is the part of the plant that does not give you a high. It doesn't give you a euphoria. It doesn't give you a paranoia. It doesn't give you the munchies. And it does that by having low amounts of THC. So by definition, hemp contains 0.3% or less of THC. So tonight, we are going to be talking about CBD products that are sourced from hemp. We are not trying to get you high. We're not trying to give you a paranoia. We're not trying to give you the munchies on this line. We're trying to get you healthy. We're trying to expose you to a plant that has a part that gives you the health without the high, and that is hemp CBD. Now, how does it do that? This is my very second question to Melissa Boston. 4.5 years ago when she introduced me to CBD, I was like, how does this work? And it works by a very, very important physiological system called the endocannabinoid system. Now, this system wasn't taught to myself, wasn't taught to Dr. Kim, wasn't taught to Dr. Betty, right? This system was discovered in the early 1990s, but this system modulates and regulates our blood pressure, our pulse rate, our mood, our sleep-wake cycle, our pain perception, our appetite, our metabolism. This is the most vital regulatory system in our body. So it works by having receptors. The main receptors are CB1 and CB2. These receptors are found throughout our entire body. Every organ and gland, our lungs, our kidneys, our stomach, our teeth, our brain, our central nervous system, our kidneys, our pancreas, our liver, our uterus. Well, if you're a man on the line, you don't have a uterus, but our reproductive organs have receptors that are looking for cannabis. They're looking for all of these cannabinoids or compounds that the cannabis plant makes to put our body back in balance. So when we look at the areas where CB1 is concentrating in, the brain, the lungs, the vascular system, the muscles, the GI tract, the reproductive organs, the immune system, the liver, the bone marrow, the pancreas, and CB2, the spleen, the bones, the skin, the immune system, the liver, the bone marrow, the pancreas. These are super important organs that CBD, when bind and consumed, it binds to these receptors. It then sends a signal to an end organ or to an area of our body that's out of balance, that's inflamed, that's angry, that's painful, that can't sleep, right? It sends these signals by this science to put our body back in balance. So CBD has a long list of medicinal properties. We've talked about some of them. We've talked about the fact that it reduces arterial blockage. We talked about the fact that it's a vasorelaxant and improves blood flow. We talked about the fact that it reduces inflammation. It also relieves anxiety and pain. It also helps to reduce the cells that are cancerous from spreading or metastasizing. It also reduces nausea and vomiting. Lots and lots of cancer doctors are using CBD. It reduces the immune function. So that's why rheumatologists are using CBD in their patients who have lupus and fibromyalgia and multiple sclerosis. But there's other compounds the plant makes, like CBN and CBC and CBG and delta-8 THC and delta-9 THC. All of these cannabinoids are compounds that the plant makes, the hemp plant makes, that synergizes with CBD to give an amazing result to the body on a cellular level. So let's look at some of our products that we offer here at Wakana. We have products by industry. We have products that help assist with weight loss. We have products that assist with your immune system. Our hair care system is a great product line for those who may have thinning or hair loss, alopecia, or maybe you want to keep your healthy head of hair, right? We all do. We have essential oils. We have skin care. So those wrinkles, I'll be 60 in October. I don't want those wrinkles. That's why I use our serum every day, right? So we have products for everyone. And what I love about our partnership with Green Scientific is that we've partnered with the top ISO lab in South Florida, Davies, Florida. I own a gym in Pembroke Park. So my gym is right next door to this lab. So I'm there a lot. But what I love about this lab is that they offer testing on all of our products, and they're very, very detailed testing. In fact, we test potency. We test for mold, mildew, heavy metals, pesticides, residual solvents, right? No one wants to consume a CBD product with mold in it. So this is crucial. This is crucial. Every product has a certificate of analysis. And this is what it looks like. We're very transparent here at Wakana. You see the potency, you see everything you need to see that's in that bottle. So let's talk about what's in the bottle. So we have our tinctures here. Our tinctures are amazing, like all of our products. Why? Because we just don't give you a CBD like the gas station does, right? We have a proprietary formula on our products. That means that we have enhanced our CBD products with essential oils like turmeric and black seed and peppermint, right? We have a line called Power that is a full spectrum line that contains the legal limit of THC. We have a broad spectrum line, our Pure line, that contains less than 0.0% of THC. So if you're on the line and you have random drug screens that you have to undergo, you want to use our pure products. We have a product that's water soluble, right? You can add it in your water. I thought I had my water here. You can add it in your water, your smoothie, anything liquid, you can add the water soluble. We also have a product that's more therapeutic. It is a very potent product. It's 900 milligrams versus our 500 and 300 milligram CBD. But this is a product for those who may have severe challenges that they want to address. So we have a product for everyone. We also have a tincture form. Oh, I'm sorry, tinctures are oils that you put under the tongue. So these products you put under the tongue, you hold it for about 60 seconds before you swallow so that it can really be absorbed in the sublingual glands under the tongue, and it can get to the bloodstream within 15 to 20 minutes. We have a hemp powered hair. That's another tincture that you can put under the tongue or topically for those who may have hair thinning, hair loss, or maybe those who want to maintain a healthy head of hair. And then we have our edibles. You know, our edibles are amazing to combine with the tincture. I never recommend just taking one product. And the reason being is that you want to keep a steady state of CBD in your bloodstream, right? So you just don't want to have a gummy. You want to pair that gummy or layer that gummy with the tincture. So gummies are great to take during the day, and they're great to take during the night. We've got gummies to take before intercourse. We've got gummies to help you lose weight. I'm telling you, you are in the right place at the right time because we have a product for everyone. We even have a coffee. Our CBD coffee, again, paired with that flat belly gummy, is a great addition to our weight loss program and weight management program. Our topicals offer local relief for those sore and achy muscles. I work out every day. In fact, today I taught 3 classes, one at 4:20 a.m., one at 5:20 a.m. Then I go to work and see patients. And then I teach again at 5:10 p.m. And then I come here by 7 o'clock and then teach this at 8. So anyway, to make my point, I love using the topicals because it gives me local relief very quickly. Our number one pain cream is our Extreme Power Pain Cream, number 1 seller in the company. And then we have our Dr. Rita's Rub. Now, Dr. Rita's Rub, I love during the day because it's a roller ball. I can just quickly roll it in areas that's causing discomfort. We also have body butters. We have our Holy Glow, which is a great facial serum with CBD that helps to reduce wrinkles and really helps to tighten that elasticity in the skin. We also have a Power Body Mango body cream, great for those ashy hands. We're washing our hands all the time. And then my all-time favorite, it doesn't contain CBD, but is our Glued Naked. Our Oud Body Glow Naked. I'm tongue-tied tonight. It's been a long day. Sorry. Our Oud body oil is amazing. I use it on my hair too, but I've got my cap on because I just worked out. But just know that this is for the body, for the hair. It's amazing. Our essential oils, again, are all organic products. I want to pay attention or show or, provide attention to our first defense. Our first defense is a nasal spray. Not only is it enhanced with our essential oils, but CBD is in it too. It's a nasal spray that really helps to reduce those viral and bacterial loads from entering the nasal passage. Love, love, love using that product, especially during this time. And then, of course, our black seed. Our black seed is like that superhuman of an essential oil. Black seed does everything. It helps with digestion. It helps with hair growth. It helps to reduce a very, very severe condition called methicillin-resistant Staph aureus, MRSA. A lot of hospitals are using black seed to address MRSA infections, and black seed can reduce, or black seed can help to rebuild the beta cells of the pancreas. So those cells that are not working well and cause insulin resistance and really cause those diabetics to be out of control. So I love black seed for that. Our smokable product is our Delta 8. Now, for those who are still smoking and increases your risk for heart disease, we want to get you on this Delta 8 pre-roll ASAP. 1 to 3 pulls is all you need. It will help reduce those cravings, and it will help reduce the withdrawal if you're withdrawing from nicotine, which we all want you to withdraw from. It's also a great product for those acute conditions. So those acute situations, right? You're about to speak on a Zoom webinar, right? Oh my God, I'm so nervous. You can use this to reduce anxiety. It can help you get to sleep faster. It can do all those same things that we talked about. CBD is a benefit. Want to tell you that we've got some amazing packages here at Wakana. And the reason I want to bring up these packages is that you really do save between 30, 40, sometimes 50% when you purchase products in packs versus purchasing products individually, a la carte. You don't want to do a la carte. We've got some amazing deals going on. Our immune pack, of course, our flat belly lifestyle. This is a great way to really get one step further to embracing a plant-based diet. We've got 3 phases of our flat belly lifestyle. We have our phase 1, which incorporates, it's not, you're not a vegan or a vegetarian, but you're more like a pescatarian, right? We're really incorporating more wild caught fish, less meat. If you are eating meat on this phase 1, grass-fed, organic, and it also includes our flat belly gummies. It also includes our bitters and our coffee. These are 3 amazing products that help curb your appetite. The bitter will detox you first for 4 days, and then you'll start with your meal plan, your exercise plan. We give you everything you need. We give you an ebook, we give you instructions. All you have to do is to purchase your product and be committed to the goal. So phase 2 is very much like, where's phase 2? Did I not have a phase 2? Oh, I think I left that slide out, but just know that phase 2, you are now doing a plant-based diet. Now it's not raw, it's cooked, but you're utilizing a plant-based diet along with the bitters, the coffee, and the flat belly gummy. This is an amazing program for those who are ready to become a vegan, but not quite ready to do phase 3. Now, phase 3 of our program is a 21-day raw cleanse. So nothing cooked, everything's raw. And I just finished mine about a month ago, was able to reduce 10 pounds of waist reduction, got more clarity, better sleep, and less anxiety and stress. So you are incorporating in phase 3 a raw plant-based diet with exercise. We give you all the support that you need in each of those 3 phases. These are some of the products in phase 3. The eliminator, eliminating parasites and mucus, yuck. We have the purifier that cleanses that colon, and then the regenerator that's helping to bring back all those important minerals and vitamins. We also have a post-3 regimen, so we're not going to leave you hanging. We will be there to support you even after your cleanse. We also have these Valentine lover packs. This is something that's still going on. You want to get this. Why? This is a great gift that I give all of my brides. So you want to get and stock up on these now. So if you got bridal showers coming up in the next month, lots of people are getting married. This is a great gift as well. Here's my contact information. I'm going to take some questions now. You can screenshot this information. If you need to contact me, my email is not on here. This is for another presentation. My email is ritamd@wakana.com. ritamd@wakana.com. Well, it's been a great conversation, and I'm ready for questions right now. So if you have any questions, please put them in the chat box. If you want to come on over to the panelist side, maybe you want to give a testimony, all you have to do is put in the chat box and say, I want to give a testimony, and I will move you over. So let's see, what is the question? Let's see. Something about a colonoscopy. I don't know what the question was. Did I miss the question? Something about a colonoscopy and your last colonoscopy if over age 45. I don't know.
I think she was just saying other preventive things that you should know the data of.
Oh, I love it. Yes. Thank you, Dr. Kim. You're right. And thank you, whoever put that in there, your last colonoscopy. Wonderful. Perfect. Any questions tonight? Dr. Kim, Dr. Betty, if you want to chime in, you can. If anybody wants to give a testimony about any of these amazing products, you can put, I want to give a testimony. Yes, Diana, I drink alkaline water. I do. Is it mandatory? Nope. You can drink spring water. You can drink alkaline water. You can drink purified water. Just don't drink tap water, please. I am a water snob. I do not drink tap water. So hopefully that answered you, alkaline, Diana about alkaline water. My alkaline water is 7.1. I love water. Wonderful. Dr. Kim, Dr. Betty, do you guys want to chime in? We have 10 more minutes. I'm just waiting for questions or testimonies.
I think you said it all. That was awesome. It was very detailed, and I don't know, I think you said it all.
Wonderful. Now, somebody said that was her lab results. I don't know what your lab result was. And let me see if I can find it. Erica wants to give her testimony. Somebody's got to help me out. Somebody is giving their lab results? I'm not sure what you're saying. Does tap water that goes to a purifier work? Yes. Tap water that goes to a purifier works just fine, Elizabeth. Oh, Diana is saying you keep all your numbers. Fantastic. Fantastic. Erica Zachary, are you on the line? Let's see. We're going to move Erica over as a panelist. If you just accept that. There she is. You can unmute your mic. For some reason, Erica, you keep popping back over on the participant side. Any other questions? Okay. Oh, alkaline phosphate is 71. Thank you, Diana. I couldn't read what you were writing. I couldn't read. Okay. Let's see. Dr. Kim, you want to take this question? What should one do who has calcium on the brain?
I don't think I quite understand what that means. What do you mean by calcium on the brain, ma'am? I was just looking at that.
Elizabeth, I'm going to move you.
Or do you mean calcification, maybe?
Oh, yeah, maybe she means calcification.
I mean, calcification actually happens as a result of chronic illness and aging. Yeah. And so what Dr. Rita's been talking about for this past hour with the CBD especially is having that on board daily gives you the best chance, or one of the best chances you have to reduce inflammation within your body, and the reduction of inflammation alone will lead to reduced calcification. I've mentioned before that I've seen two different studies that actually show in animal studies, of course, that CBD on board can preserve the tissue in people, in animals that were put under conditions of heart attacks and strokes. And so that is like a major, major thing. But calcification is going to happen with high blood pressure, diabetes, and these are inflammatory processes that if you have the right CBD on board, and I can tell y'all, based on my patient population, what kind of CBD has been kicking butt in lowering blood pressure, helping blood sugars, lowering stress. And I do testing that actually pinpoints the small particles that can invade the blood vessel wall lining through the Cleveland Heart Lab. And when I do a before and after with patients who are doing the CBD, there is a remarkable difference with the inflammation. So calcification is what I think she means, and the CBD can definitely help.
Fantastic. And right before we do our two testimonies, Rosalind Lee says, I'm new to CBD. Which product is good for high blood pressure? So Rosalind, I just want to read the disclaimer that the FDA has not approved any of these statements. If you're nursing, pregnant, on medication, under a doctor's care, please consult with your physician. We cannot make statements that our CBD products will cure, will mitigate. Okay, we have to be very careful when you ask a question like that, like which product is good for high blood pressure. What we can say is that CBD can assist with some of the symptoms that we see with high blood pressure, okay? So I wanna make sure that disclaimer is out there. So Dr. Kim, you wanna
Yes, ma'am.
address her inquiry?
I'm sure, first I do want to say that, remember, these are my own patients. This is not something that I'm doing with random people. So please listen to what Dr. Rita said. In no way am I saying that CBD is going to cure at all, but I can say that it has helped many of my patients. Please make sure you're speaking with your doctor if you're taking prescription medicines. And by no means should you just stop taking your blood pressure medicine and switch over to CBD. You need to do this under the guidance of a doctor. So my patients are doing the tincture and the gummy. And whether they do the broad spectrum, which is the pure, or the power, depends on whether they have to do drug testing or not. So if I have a patient who does need drug testing, it's the pure tincture and gummy. If they do not have to do drug testing, then I give them the power tincture and gummies. And I will have them start with the low dose, which is 3 drops under the tongue twice a day, and a fourth of a gummy twice a day. And that is a perfect place to start, easy to titrate up if we need to. And I have them watch their blood pressure every single day. I want them checking the blood pressure in the morning and the evening. And as we see their numbers improving, then I can cut back on their prescription medication. But it's a team effort. This is not something that I would recommend anybody do on their own. You would want your doctor involved. And if you don't want to talk to your doctor, then maybe you need to consider getting a doctor that you feel comfortable talking to, because it needs to be a team effort.
Fantastic. Thank you so much, Dr. Kim. We've got one other question, but I want to take Erica Zachary, her testimony first, then we'll take a question, and then we'll do Elizabeth's testimony. Hi, Erica.
Hi, can you hear me?
Yes, there you go.
All right, thank you. So, I'm always compelled when you're looking for testimonies and nobody speaks up, because I'm definitely a product of Wakana.
Yes.
And so, I initially came into Wakana. Sorry, I'm holding my phone because I'm still working. But I came into Wakana because I had multiple sclerosis, so I was trying to control and mitigate some of the symptoms that I was having. Not mitigate, but to control the symptoms that I was having, in terms of muscle spasms and spasticity and anxiety and all the stuff that comes with just not knowing how you're going to wake up each and every day. If
Mm.
anybody knows about MS, right? So I wake up, some days I'm feeling great, some days I feel like crap. So I needed to get to a CBD product that was going to work for me consistently. And Wakana did that for me. But what I will tell you is that, so I'd had a lot less fatigue, and a lot of the symptoms that I was having were very much changed by me taking the product. But what has happened more recently is the flat belly products have really, really, really changed my life. I have lost 54 pounds, 54 pounds doing all of the different phases of the program, phase one, phase two, phase three. I don't recommend that people jump into phase three unless it's something that they're already doing to, eating healthy and, pretty much vegan, but just need support. Um, but it was the best thing that I could have done for myself. I'm back at a weight that I haven't seen in 30 years before I had my daughter. I've struggled with weight. I've struggled with, just trying to be consistent for 30 years, So just having the support and being able to cut the cravings in the beginning with using the bitters and the coffee, which I drank literally every single day. It helped me I have kids in my house that have, bake. My daughter's a baker. She has her own cake business. My son at the time was working for Cold Stone. Tell me, I needed to cut
Oh my
cravings.
gosh.
Oh my God, because we always have ice cream. We always have cake in our house.
I
So
haven't
I
had
needed.
Cold Stone in years. Oh my God, I
Oh my
love
God,
it.
you don't want to eat it, but I don't crave it
I'm
anymore, Dr.
vegan
Rita.
now, so
Yep, right. Well,
yeah.
yeah. But so since I've done the phase three and doing the 21-day cleanse, and I ended about 3 weeks ago, my husband and we haven't gone back to eating meat. We still are practicing a vegan lifestyle.
I love
And yeah, and it's been fantastic. I feel great, moving better, just all of that. I used to
it.
not cook, but not be able to go up and down my stairs really well. Losing that much weight and controlling a lot of the MS symptoms that really helped me a
Can
lot.
I
Just
tell
from a
you how clear your skin looks? Your
Yeah,
skin
it
looks
has, and
different.
it's thank you, thank you, thank you. My
Yeah.
hair is growing, and yeah, just all of that. So it's just been amazing. So I love Wakanda for
Fantastic.
lots of good reasons.
Thank you. Thank you so much, Erica. You look amazing. I know you feel amazing. Thank you for that testimony. So we're going to take one question, and then Elizabeth, you'll be up next for your testimony. Kay Wilson says, I have a customer who is in palliative care with liver cancer and wants to increase her appetite, and what product will help with itching and sleep? So Dr. Kim, right out of the bat, I was thinking, I was really thinking palliative care, liver cancer. I first thought about Delta 8
Yeah.
gummy, along with tincture. I never ever want to give anybody one product. You always want to layer, you want to always include that tincture as well as the gummy, and maybe even find out, typically with liver cancer, they may have some metastasis to the bone, they may have some pain,
Mm-hmm.
even the topical, at night, or even the Power Body Mango body cream will also help soothe the skin and reduce that itching. Dr.
Yes,
Kim,
ma'am.
I
Absolutely.
chime in.
I agree. Yes, ma'am. I was thinking the Delta 8 is as well. And the tincture. I do the same as you do. I don't get a lot of, not the success level that I want when there's only one product being used. So if you're talking about pain for sure, then the tincture, the gummy, the cream for sure. And if it's acute pain, then the vape as well.
That is very true. Now, right now, we only have that Delta 8 pre-roll. So for
Mm.
your customer, Kay Wilson, I would really recommend, for symptoms that they're having probably that come with having cancer, I would recommend the tincture, the Hempranium 500, the Delta 8 gummy, you can start with the Flight 25 and the topical and the pre-roll Delta 8. I would do the tincture twice a day. I would do a quarter first of the gummy, Delta 8 gummy, Flight 25 at night, along with the pain cream at night, and the smokable whenever they have acute symptoms. You want to increase the appetite. I would do 1 to 3 pulls before each meal to increase the appetite as well. Hopefully that helped, Kay Wilson. Elizabeth, let's hear your testimony.
Hi, my testimony is very personal, and hopefully it will help the young lady that you were just answering the question for. Yesterday, I attended a funeral for a very good friend, and last May, she called me at 7:30 in the morning, so I knew that was a bad sign. I was already at work that day. Anyway, she said, I thought I should let you know before I go in for my first chemo treatment. She was going that day.
Wow.
So she had a diagnosis of anemia first. And it turned out that it was cancer. She had no symptoms other than the fact she'd gone in for her regular checkup, and the physician called her and said she had anemia and wanted to know why. So basically it turned out that she had gastric cancer. So she lived until, I think, February 3rd. So in the meantime,
my condolences.
Thank you. In the meantime, she was not able to retain any food because she was so nauseated. So we were able to give her the tincture, power tincture, some power gummies, which helped also with pain as well as the nausea and discomfort she had. And she had a lot of abdominal pain. So just rubbing on the 400 milligram pain cream as well as Dr. Rita Rub, that helped her tremendously. And then just being in the bed continually, she had a lot of shoulder discomfort. So again, the 400 milligram pain cream as well as the tincture helped her a great deal. So those 4 products really, really helped her get to a point of comfort. She came late after our 21-day cleanse. We came late to the idea of giving her the juices that are part of the 21-day cleanse, giving her 3 8-ounce bottles of juice per day from our 21-day plan. And those helped. She was able to consume those for about 2 to 3 weeks, whereas before she had not been able to keep anything down. So I'm saying that as we work toward generational health now with our 21-day plan, and we're helping our friends and our colleagues and our patients, these are the products that helped her. And I, of course, have my own personal testimony of the products that I use, but for now, that will do.
Thank you so much, Elizabeth, for sharing that.
Sure. I want people to know.
Yes, yes.
That's why I said colonoscopy. When it was your last colonoscopy and or upper GI workup, because we need to know how our bodies are. And as African Americans, then now the recommended age is 45 for your first exam.
Thank you so much, Elizabeth, because that is so important. There was a study, I don't know where it was, maybe Dr. Kim remembers, but honestly, this study showed the increased incidence in colon cancer in African Americans. They linked it back to us barbecuing, and many of us that barbecue and grill, we use charcoal. And when charcoal is on your food, them crispy ribs and brats you're eating, your colon cannot break down that charcoal. So what happens? It is a nidus for cancer. That toxin from the cola, from the charcoal, from the burnt meat, all of that is very unhealthy for our colon. So when my father learned that back in the 70s, he started grilling on a gas grill, right? So that's just a little tidbit. But thank you so much, Elizabeth. That was very, 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 very helpful. So thank you all for joining tonight. It's been a great conversation. I want to thank each and every one of you, but I do want to remind each and every guest, if you're on the line, I want you to connect with the person that invited you so you can get these products in your hand. Get these products in your hand as soon as possible. If you live in the Chicago area, you can pick your products up from our dispensary, 411 East 35th Street. If you're not in the Chicago area, we will fulfill your order tonight and get it shipped out tomorrow so that you can get these products very, very quickly. So I want to let everyone know on our medical advisory panel, Erica Zachary is, Dr. Betty, Dr. Kim, thank you so much for joining as a panelist. And Elizabeth, thank you so much for your testimony. Erica, thank you so much for your testimony. But more importantly, I want to thank all of our attendees for participating, by asking such great questions, by really engaging in our conversation, that we can make a difference as it relates to African Americans and heart disease and cancer and diabetes and all of these other chronic illnesses, that we can utilize CBD, we can utilize our plant-based knowledge to really make a difference. So with that being said, good night, be well, be safe, and we'll see you next Wednesday. Thank you so much, everyone. I appreciate you all.